Thank you very much for staying with us on Focus on Health. If you're joining us right now, we have been talking about oral hygiene, and we've been with Dr. Pranay Sharma.
Yes.
Thank you very much, Doc, for staying with us. So before the break, we were talking about generally the overlay and, of course, what dental or what rather oral hygiene is. But right now, we want to go a little bit deeper into what it is all about. And we'll be talking about the relationship, of course, between the food we eat and dental hygiene. What is the relationship, and why is it so important for us to know or be careful of whatever we eat?
You see, basically, as I told you, the food which gets in your mouth is basically pertains to how the microbes behave. In our saliva, there are many microbes which actually work for us, for our body, but given the certain circumstances, they also turn against our body. So phenomena like gingivitis, dental caries, these are nothing but those microbes, our own body turning against us, had it to add some extra, factors from outside, which is our food, of course. Right? So obviously, as I mentioned, habits plays a very important role. If I come to food, particularly fibrous food is very good. Yeah. Even if I wouldn't say no to sweets, but if the sweet increases the pH and if it is managed by, a fibrous food to accompany it, that helps the betterment of the tooth. One thing which is very important to note is our teeth are made up of many minerals, and especially the outer layer, the white layer that everybody sees on a tooth, called enamel, is very strong. It's even stronger than our bones. But I would contradict if somebody would ask me now that, Terry, I was biting on a bone and my tooth broke. And you said that it's even stronger than my bone, so how come? It's because the bone that we bite on the food, it's actually on a larger surface area. Our teeth are supposed to bite on smaller bitings of food per the surface area.
The surface area, of course.
So if you bite on something harder than an object, but it's not, it's bigger, and the mechanism of the things, your mechanics are smaller, then obviously you'll cause injury to your machinery. So that causes, through my years of practice, I've seen, especially in our population around here, a lot of oral injuries is caused because of food. A lot of people would come to me, I was biting and then I lost my tooth. As I said, more fibrous food, less carbs, less fats. The food which would stick on your tooth, between your teeth, can cause a lot of damage if not taken care of.
Of course, and now when we talk about dental checkup, you mentioned it earlier on that it is supposed to be after every 6 months. But as a patient, I'm coming in. What should I expect, and what the outcome of it at the end of it all?
You see, if a patient doesn't have any issues, no pain, nobody knows your body better than you. If I have a toothache, I think I will know it better. Or if I have an initial decay, or if I have a gum injury or a gum disease, I think I would know better than before I enter the doctor's chamber. The whole idea is to avoid worsening of the condition. It's similar to people would go and get their calcium levels checked, their cholesterols checked. So why not come to a dentist and get your teeth checked?
Wow. That's a very good. That's a good question. But of course, when you've been in the field so long, and when also I know the pharmacists know this very much, and of course, people go to the pharmacist needing that they need some painkillers. We have the Dentomol, we have diclofenac. People use this so much. Does it have a risk?
Of course it does. Of course. Even according to WHO, by the year 2023, antibiotics would have lost effect on human population. The only reason is because we overuse them. So there is a resistance that the bacteria, they're evolving so fast in our body, then they stop reacting. Yeah. Similarly, our body, the nerve endings, there's so much anesthetics and analgesia that is in the market, freely available, marketed to people, that instead of coming and getting themselves seen to a doctor or taking care of themselves at home, they would probably go to a pharmacist and pop a pill and get rid of the pain and forget about it, unless now it comes back. So of course it has its risk factors.
And now that you mentioned it, so what are some of the home remedies if you may be having these
oil?
pains that we've just talked about?
Clove oil is something that I've used. It works wonders, but only for a little while. Like if you're at home, obviously you can't find a dentist at 12 midnight. So to persist till next morning, clove oil is a very good thing.
How do you apply it?
Just clove oil. You take it in a cotton, squeeze it, and it should relieve. Yeah. Plus, eucalyptus oil is very good for gingivitis. Yeah.
So those are the only two home remedies?
Yes, unfortunately, yes.
And of course, when we also talk about this, then we have the tooth wear and tear. Could you please explain what this really means, and also putting into perspective that an 18-year-old may be having a very bad teeth, while at 60 or 80-year-old has a very strong teeth. Yeah.
You see, tooth wear and tear could be damage to the outer layer of the tooth by any means. Decay is one and obvious. Other is in young adults or teenagers. Sports injuries play a very, very important role. As much as a person playing on the ground and hits the ground, the tooth breaks, and the person is remaining with non-vital tooth, meaning the tooth is half broken. It has no functionality and no cosmetic value. So those are the few reasons what can cause the wear and tear of the tooth.
And now when we're talking about, we should also talk about, of course, the fads, the myths and misconceptions that come with the discussion that we're having today, and especially being targeted rather at pregnant women and young children, being told that you should not go and do this and this and that. What are some of those things that you've been able to hear, and what is the fact behind them?
See, the thing is, first trimester or the first 3 months of pregnancy are crucial. But that is where the organs, the heart, the major organ of the embryo starts forming. At that time, there is no problem coming to a dentist, but yes, radiations can be a problem. There can be procedures done, but there are some procedures which cannot be done on pregnant women, especially which pertains to administering anesthesia. Because of, not of any other reason, but a person can be, or a lady, the pregnant lady can be allergic to anesthesia. So, you might find you administer and she might go into, an anaphylactic shock or hypoglycemia. So those are the reasons that we avoid. But until that, there is no problem for a pregnant woman to come to a dentist. For children, the radiations are absolutely safe. We provide lead aprons to the operator and the patient so that they don't unnecessarily, absorb radiations. Plus, one thing I want to make it clear to our audience as well is dental x-ray is very, very minimal exposure. It's very minimal. And we don't take the full body x-ray. It's just a small area, very small exposure, done within seconds. So it's nothing to worry about.
And of course, we'll also love to know about the progression. Of course, when somebody is having all these, is there any thing that we should come and do, or if it's happening, then that's it? Progression in terms of the decay and the cavity and medication that should be administered.
Modern dentistry has got many advancements which can arrest caries, but the initial caries can be controlled, especially in children with pits and fissure seals. Basically, these are materials which are applied prophylactically, as in to prevent decay, on a child who has erupted permanently. Yeah, and basically that way we seal the spits and fissures of the child, which is the most common and problem area where the decay starts. But if at all the decay has also started, we can remove that part and it can be easily restored with the restoration state material.
But how cheap or expensive is this process you're talking about?
You know, I don't think I can put a price on someone's body.
Yeah, of course.
It's not very expensive. It's very affordable to patients. There are many insurances companies. The governments are running many schemes where a very small minimal amount has been taken from a person's salary, and a comprehensive medical cover is given to the whole family, which covers dental at a very great extent as well. Yeah. So all these things they get sorted out.
Any final words that you have for us, Dr. Sanjay?
Nothing much. Just keep your diet clean, your teeth clean. That's it. Any problems, your dentist, the nearest dentist is there to help you out.
Thank you very much, Dr. Yeah. So that's all we had for you on Focus on Health on this particular episode. And we've talked about oral hygiene and what it means, and also what the do's and don'ts that you at home you should be taking care of. And that's all we had for you on this particular episode. So we'll be leaving you with the Healthy You segment. Bye.
Here are a few ways you can help keep your gums healthy. 1. Floss. Floss at least once a day. 2. Get regular dental cleanings. Your dentist can detect early gum disease symptoms if you see them on a regular basis. 3. Quit smoking. 4. Brush twice a day. 5. Use fluoride toothpaste.